U.S. vaccine manufacturer Moderna says the first COVID-19 vaccine facility in Africa will benefit at least 1.3 billion people on the continent. Moderna is signing an agreement with the Kenyan government to build a facility which is expected to produce up to 500 million doses a year. The vaccine manufacturer says the move is aimed at increasing accessibility to COVID-19 vaccines on the continent. Let's get you more on the story. We're joined now by Dr. Lisa Tetteh, who is a medical expert in Accra. She joins us from Ghana this morning. Dr. Tetteh, it's great to have you with us on the program. Is this the game changer that it's being touted to be?
Thank you for having me. I believe that it's a very, very good initiative. It's very innovative. And yes, we can say it's a game changer because we know that Africans have been suffering from vaccine deprivation. Most of the time, the larger countries, more powerful countries go ahead of the vaccine production or go to the pharmaceutical companies directly to pay for these vaccines. And so they have the vaccines first hand. So I believe that if we have a center here in Africa that is supposed to serve the whole region, it is a game changer and it's going to benefit us a lot.
Yeah, Africa being called the world's least immunized continent in the statement by Moderna. What's the vaccine coverage? And this is a broad generalization, but what is the vaccine coverage on the continent?
So I think the vaccine coverage is very low. I was reading a percentage, and I think it was 1.2% based on what I read the last time. And so the vaccine coverage in Africa is really low. And so this is because we mostly have to rely on aid. So we're waiting for aid, we're waiting for money, we're waiting for the more powerful countries to donate to us, and we're waiting for WHO to ask them to give us some vaccines. And so that has been a very big challenge for us. And so it's difficult. Also, when the vaccines get here, we don't have money to actually distribute the vaccines. Then there are issues of logistics, resources, even sometimes transporting the vaccines to the places where they're supposed to be given is a challenge. And so we've had issues of certain vaccines getting spoiled or going bad, if I should say, in countries. And so there's always also the challenge of education. Our cultural background makes it difficult for people to actually accept the vaccine. So even when the vaccines get to us, there's a challenge of educating people. We need money to educate these people, to do advertisements on radio, television, and all of that. And so there are lots of challenges that come with the vaccines as well. I also believe that with certain mindsets of people in Africa, if we know that the vaccine is being produced in Africa, it would create a sense of belonging. And I believe that some people would be more open to taking vaccines created in Africa, if I can say, than from outside. So it's going to be a game changer, really.
Yeah. I mean, everything that you've just outlined insofar as the challenges, the education issue, etc. is concerned will impact on the next question I have for you. Because, you know, as we wait for the intellectual property waivers, if indeed they will come into being, to allow for the production of vaccines and treatments in countries on the continent, it's not just about that waiver, is it? Just given what you've just said about education, about the hesitancy when it comes to vaccines that are produced, ironically, on the continent.
It's not just about that, but I think that with it being in Africa, I think it's going to impact largely on people's acceptance as well. And, you know, because we think that we have the ability, we believe that we have the ability to be able to produce our own things. So it's going to make people feel a part of what is going on. You know, when people don't feel a part of something, it's difficult for them to accept. And there has been a challenge of feeling a part of this whole pandemic, especially in Africa, because we're not recording as many deaths as other countries are recording. It doesn't seem to be hitting us as much as other countries are being hit. And so if it's in Kenya, we feel like it's a part of us. We feel like we're part of the solution, and then acceptance would be easier. So yes, this is this together with other challenges are going to be difficult to handle, but it's a step in the right direction, if I should say.
Do you think that the intellectual property waiver would work on the continent, given what you've also said about logistics insofar as when vaccines do arrive in certain countries, Some of them do get spoiled because of the logistics of keeping vaccines at a certain temperature, perhaps distributing them, etc.
I think it would work, but I think all of these things are being put into consideration because, of course, if we're establishing a vaccine center, then, of course, we need to put all the things that need to ensure that the vaccine is going to be safe or is going to stay longer. And so I think that it would work together with all the other things that we bring together to ensure that the vaccines are safe and they are stored very well for us to be able to give to our people.
Yeah. COVID-19, the pandemic over the past 2 years, revealing really some of the big challenges, the big gaps in the healthcare systems in many countries, not only on the African continent. Where you are, Dr. Tetteh, what are some of the holes that have been identified, and what are some of the steps, some of the lessons that have been learned?
Well, I think that the steps have been, whatever has been identified is cuts across our health system. It has exposed the weak health systems, not just in Africa, but in the whole world, because it's hitting people. You know, we designed our health systems not to take so many emergencies at a time. Our health systems are not designed to be able to solve issues that come with pandemics. And so imagine the health system is being hit all of a sudden by so many infections, and that has been a very big challenge because now there has to be a lot of restructuring. And especially in Africa where we have very low resources, it's a very big challenge as well. Then now the pandemic is not just hitting people who are not in the healthcare system, but it's hitting people who are in the healthcare system. And so people are falling sick. These people who are already being overworked have to be asked to go and stay at home. They have to be isolated for like 14 days or 7 days, that as it is now, so that they can go and get better. This is going to reduce the workforce in the hospital. Then with a reduced workforce, they're still having a lot of infections coming in. And so the health system is being hit, not just in terms of the structure, but in terms of the personnel who are working as well. Then the issue of education. It's difficult to get people educated in certain areas. You know, there are certain people who have no access to television, who have no access to radio, who have no access to any form of communication. The only thing they do is wake up in the morning, go to their farms, and then come back. So they are completely cut off from every form of information. And so it's difficult to get the message across to people out there. Imagine the first time you see somebody, you're telling the person that there is a disease and this is a vaccine for the disease. The person hasn't even heard of the disease. The person hasn't seen anybody experience it. How does the person trust you? And so these are some of the challenges that we have identified. And we've also identified all the economic challenges that have come with COVID-19. Of course, it has hit us, especially in developing countries where we are dependent on aid. So now the foreign countries, or the stronger countries, if I should say, don't even have enough money to give us. So it's difficult for us. It had a challenge on how much food we are getting or able to give to people, employment issues. It's had a very, very big challenge in all of us. And I think that for most of us, we are trying. For most countries, we are trying. In my country like this, we've been lucky to get some aid. We've been lucky to get some of the vaccines. It's challenging for the government, but they are trying to do a lot of restructuring. So now it looks like a lot of governments would come up with this policy they believe would work. Then they hear, oh, there's a new variant. It's hitting more people. Then whatever they planned doesn't work again. They have to go back to the drawing board and replan and reassess. And so there have been times when we've thought that governments, I remember there was an interview I did when the South African minister said no contact tracing. And we've had issues in our country where we feel like, okay, the government maybe doesn't care that much, but it's because of the economic challenges they are going through and having to restructure all and ensure that at least no sector is hit hard. And so sometimes they make certain decisions.
Dr. Lisa Tetteh, apologies for interrupting you there, but I think your point is well made. A number of wide-ranging challenges, not only in countries on the continent, but certainly around the world as well. Dr. Lisa Tetteh is a medical expert in Ghana for us this morning. Moderna's announcement of this first COVID-19 vaccine facility in Africa.